In this video, I'm going to do my best to try and do a quick overview of antibody panels, what they are, how they work, and some features of them. Now, starting off, there are a couple different methods that you can use to perform an antibody panel. One is the gel method, and another is the tube method, and there are also instruments that do it now. Basically, for the gel and the tube, they're basically done exactly like the screens are, which I already have videos for. But essentially, an antibody panel uses red blood cells with known antigens to identify unknown antibodies in patients. As you can see, there's the antigens are listed there at the top, and then all the pluses and zeros that you see there are basically what antigens are present on the red blood cells and which ones aren't. So in this, we're going to be testing patient plasma. So there's a lot, like I said, to a panel, and I'm just going to point out a couple things as we go along here. One of the things that I think is probably pretty important off the get-go is going to be homozygous and heterozygous cells. And what I'm specifically referring to, and I'm going to use Kel here as an example of what I'm talking about as far as homozygous and heterozygous. Basically, if somebody is homozygous, it means that they only have one allele, or will they have two alleles that are the same. So, for instance, here where you see a little k and a big K, and the little k is positive and the big K is 0, that means that person or that cell is homozygous for little k. Now the opposite would be if there's a positive for big K and a positive for little k on the same cell, that means that it is heterozygous. Now typically you want to rule in and out with homozygous cells. Also, if the cells, the antigen so dosage means the reactions will be stronger with a homozygous cell, and that's why you prefer to use homozygous, because in theory somebody or antigen that shows dosage may come up as negative if it's heterozygous. And you can see that that's all over the place. Also, I wanted to point out that the shaded areas on your anagrams, those indicate usually the cells that are destroyed or depressed using enzyme treatment. We don't even do that where I work, but that is what it means. You will likely be tested on that if you haven't already. So I just plugged in some answers over here on the right. I also want to point out that when you do a panel, typically you want to do an auto control. Now, some places might require you to do an auto control with your screens as well. And basically, an auto control is the patient's red blood cells mixed with their own plasma. And this is just a method of ruling out like a warm autoantibody that might be causing positive reactions when it's just an autoantibody. So what I'm doing now is, if you have a 0 reaction, you would go through that cell and you would mark out all the positive antigens, because if you're getting a 0 reaction for that that cell, then anything that's positive it can't be, essentially. So here I just went ahead and just filled out all the little cross-outs. Not everybody does this. I certainly don't really anymore go to this extreme. I accidentally made a little oopsie on here on the right for the Lutheran B. I put too many crosses. But basically what you're looking for in most places, they want 3 cells to rule out and 3 cells to rule in. So you would be looking for 3 cells crossed out for that particular antigen, and then to rule in, like I have for the big K or the Kel, there's 3 positives, which is basically what I filled in there was for the big K or Kel. And that's really, that's just a quick overview, and thanks for watching.